Hello everyone, I'm Dr. Leena Chatterjee. I'm President Strategy and Growth at Dr. Dang's lab. I'm an MD in pathology and have been working in the lab segment for very many years now. We have soon coming up the National Safe Motherhood Day, and it's my privilege to be able to share my thoughts and views on that subject with all of you. I hope you like listening in, and thank you. I just want to say that so much has been spoken of as well as written about how beautiful motherhood is. We say it is joyful, it is soulful, it is uplifting, and so many, similar kind of words have been used. But I would like to say that none of them hold true if the entire motherhood hasn't been safe per se. So safe motherhood is really the mantra, and that's what we are going to be discussing today. And when we talk about a woman getting ready to have a baby, when a woman is ready to have a baby herself, firstly, though 18 is the official age for marriage, but I believe that at least the woman should be at a minimum around 22, 23 years of age. That would be the lowest that one should look at for having a baby. She must take great care of her nutritional needs, and also in case she has any existing health conditions at that point in time, she must take treatment, seek out a physician, and take advice at least for the treatable conditions which are there. Another thing to watch out is that there are families where there could be some inherited disorders which run in the family. In case there are siblings or people in the close family who have such disorders, then certainly genetic counseling is something that is to be recommended, which could be done even before getting pregnant. More and more women as well as their partners today are choosing to get some of these tests done even before they get pregnant, such as checking out for abnormal hemoglobins, for which you may just be a carrier and not really manifest the disease. However, if both you as well as your partner are carriers, then obviously the risk of the child having that condition is far higher. So yes, abnormal hemoglobins is something that people are screening out even before they decide to get pregnant. I would like to introduce the concept of 1,000 days of care. And what really is this 1,000 days of care? It is from the period of conception till the time that your child is 2 years old. So very typically it kind of translates into 270 days. Well, it can't be an exact number, but very broadly translates into, let's say, 270 days of pregnancy from the time that you conceive, and about another 730 days, which are the first 2 years of your child's life. And during this time, I think even once you do know that you are pregnant, whether by way of a pregnancy test that you've got done at a lab, or there are some self-test at home cards available. However, even if you do test at home, I would very strongly recommend that you go out to a lab and get your beta HCG test done in order to confirm. Once you have, confirmed that you are indeed pregnant, you must certainly look out for a good gynecologist, someone who you can relate to, have faith in, and then entrust yourself completely to the physician's care, and your obstetrician will guide you on the kind of nutrition that you need to take, will guide you on the pathology tests as well as the radiology tests that you need to do, your vaccinations, treatments in case you have any anemia or something like that. So typically most labs today have something which is called an antenatal panel, and whether under the advice of your obstetrician or even if you would like to just get that done yourself, at a very basic end, an antenatal panel, which might differ a bit from lab to lab, but it would have a mix of tests to rule out anemia, to rule out in case you have raised blood sugar, in case you have thyroid, disorders, any urine infections, and also an array of viral markers, which would be HIV, HPSAG, and HCV. So this is a classic basic antenatal panel. Labs also have an extended version of this where they also include torch testing, and torch testing is typically a mix of toxoplasma, rubella, cytomegalovirus, and herpes simplex virus 1 and 2. And for each of these, we test for IgG and IgM. To clarify, IgG picks up whether you have been infected in the past, and IgM indicates recent infection. So these are all infections that can be passed on from the mother to the child, and your obstetrician will advise you on how to deal with any of this should they come positive. So there are some women who have had a bad obstetric history, and a bad obstetric history would mean somebody who's had miscarriage earlier or has had a stillbirth earlier, or any kind of pregnancy complication. In these cases, your obstetrician may advise you to get what is called an anti-phospholipid syndrome panel, and these are a set of antibodies which, if present, can cause mothers to have bad obstetric history. There is also maternal markers that are tested for a set of conditions. Again, if there are inherited disorders of certain categories in the family, also raised maternal age. So maternal markers, typically they let you know about the risk. They don't diagnose anything. It's about what is your risk vis-a-vis the risk that exists all across to have a baby who has Down syndrome or Edwards syndrome or neural tube defects. So these are the additional kind of tests that can be asked for. But really, I think, if we look at nutrition, if we look at healthy, happy, and safe environment for the mother while she is pregnant, that remains of paramount importance. Yes, so once your baby is born, and we look forward to, passing the next 2 years of the baby in good health. So suddenly, from your requirement of having a good obstetrician, while that some checkups will continue, you would now need a good pediatrician or a neonatologist who will give you excellent advice on how to deal with the baby and any episodes of fever, infection, and such like, which will happen over the next 2 years. One thing I'd like to say is discharges nowadays often happen very early, particularly for normal deliveries, and in fact even for cesarean sections. So one thing, while the physician during discharge will certainly check, you could, once you reach home, also watch out for any sign that your baby may be showing of neonatal jaundice, where if you feel your baby looks even very slightly yellow or is lethargic, kindly rush back and show the doctor, because a neonatal jaundice is something that is very easily treatable, but if left untreated can have a host of complications. Again, if I talk about breastfeeding, exclusive breastfeeding is what is recommended for about 6 months of life and of the baby's life, and after that you can have your pediatrician advise regarding the complementary food supplementation which is going to be required for the child. I would like you to not forget about the immunizations, because the government has laid out the immunization schedule in great depth. So again, your pediatrician will advise you on the same, but make sure you do not miss a single one of them. Actually, they say that the age of 2 to 5 in a baby's life are sometimes the most beautiful, because they say there is something new that your child is doing every day during that time period. And in order for you to be really able to enjoy that 2 to 5 year time frame, I would urge all mothers to be or new mothers to remember that 1,000-day and safety during the 1,000-day period, and that will hold you in absolute good stead. I would urge all of you to practice safe motherhood and to keep yourself, your baby, and your family safe.